Drug overdose deaths continue to go up nationally according to recent government statistics, and that trend is mirrored right here in Crosse County.
But the drugs causing these deaths may not be what you'd first expect. News 8's Madeline O'Neill is now here with more.
Martha and Mike, statistics from the Crosse County Medical Examiner's Office can now be found on the county website. Dating back to a few years ago, they show a steady increase in drug-related deaths from 9 in 2014 to 25 in 2016. And now looking at the numbers so far this year, health officials expect that trend to continue.
Sad to say it's on a continuous increase.
In his 10 years as Crosse County's medical examiner,
Went from 9 to 12.
Tim Candle has watched drug-related deaths rise.
When I first began, it was maintaining about, anywhere from 0 to 12. Now we're pushing to 12 to 20, even a little higher.
There were 9 drug-related deaths in 2014, 12 in 2015, 25 in 2016, and now, less than 9 months into 2017, 28 drug-related deaths are listed. Now that includes deaths such as drownings or car crashes where drugs may have played an indirect role. But even excluding those deaths, county health educator Al Bliss says it's safe to say the county has had about 21 overdose deaths this year, some which are still pending.
The number of overdose deaths and drug-related hospitalizations have gone up in our county.
Meth, cocaine, and prescription drugs are commonly found in overdose deaths, often in some kind of combination.
Now we're seeing a combination of 3, 4, or more.
But Bliss can point out one highly talked about drug that's missing from this year's overdose death report.
Yeah, there's 0 heroin. I'd like to think that that seems to be promising, but in a sense it seems like more of a shift because we're seeing other drug overdose deaths.
But just because there are 0 heroin deaths doesn't mean there haven't been overdoses.
There's people out there that are saved every day.
This year, Gunderson Tri-State Ambulance is expecting to administer more than 200 doses of the opiate reversal drug naloxone, commonly known as Narcan.
If it wasn't for the Narcan, my office would be running ragged with just overdoses all the time.
Candle says shortage of mental health care access is at the heart of the overdose epidemic.
As long as we continue to have mental health problems in this country, I don't see that going away.
In honor of Overdose Awareness Day, the Heroin and Other Illicit Drug Task Force will host an event at the Northside Community Police Station in La Crosse for anyone interested. Speakers will recognize those affected by the overdose epidemic and talk about what's currently being done to address it.
Thanks a lot, Madeline. And 4 of the overdose deaths reported so far this year still have pending autopsy results.